Doctors/nurses, what's the most hilariously wrong self-diagnosis you've heard that still haunts you? I'm not a nurse, but my mom is a nurse practitioner and worked in the ER. She had a patient come in because she thought she was having a miscarriage. She was 3 months pregnant with twins. When asked why she thought she was miscarrying, she said that she had thrown up. Confused, my mom did an exam and ordered an ultrasound to be done. The babies were fine. After my mom told her this, the mother said, "But I was throwing up amniotic fluid, and I thought the babies would drown in the air without it." Turns out, it was morning sickness. My mom tried to explain to her why it was impossible to throw up amniotic fluid, but she refused to believe that the womb did not, in fact, connect to the stomach. Saw a patient for a follow-up after my colleague put her on birth control to stop ovulation as a way to remove her ovulation pain. Asked her how it was going and she said it was terrible, she's still having pain with ovulation. Went back and forth on, but you're taking the medication? Yes. So you're not ovulating. Patient insists she's still having ovulation pain. Asked her when in the month it occurs, she says when she ovulates. I ask how she knows she's ovulating then and she says because it hurts. I mentally throw myself off a bridge. I ask her to use one finger to point to the pain and she points to her left ribs and says it hurts right there and it hurts there every week or two, which is how she knows she is ovulating. For those who don't know, your ovaries are nowhere near your ribs, not even a little bit, and can cause rib pain, and you ovulate only once a month, definitely not 2 to 4 times, and definitely not while on birth control that stops ovulation. Brother thought he had cancer and worms in his organs and tried to prove it to the doctors. Turns out he actually has schizophrenia. A patient came in and said he was allergic to oxygen because, as he noticed, when he breathes, his head starts hurting. I tried to explain that it might just be tension, but he insisted that oxygen was his enemy. I still can't figure out how he came to that conclusion. A guy came in and said he had a sunburn from sunscreen. It was so absurd that I started wondering if he had burned himself trying to prove something to the universe. Yeah, he still insisted on wearing that magic cream. A patient claimed his back hurt because negative energies from the internet had entered his spine. I wanted to respond by saying it was probably related to his desk job, but I decided to just recommend changing his Wi-Fi channel instead. One day, a patient said he couldn't eat fried food because his insides were all melted from the oil. When I explained that fried food doesn't do that, he replied that oil was his personal antipolymer. Well, how do you argue with that? A patient came in complaining that his eyes turned blue from too many blue LEDs. I asked how much time he spent on the computer, and he answered, "I only work 18 hours a day, but it feels like Windows is getting me hooked on blue light." A patient came in complaining about insomnia. He said he can't sleep because his bed is looking at him with a judgmental stare. I asked if he wanted to try changing his position, and he replied, "It just doesn't accept me." I suggested a new pillow, but he said it was in love with his old pillow. Looks like beds are starting their own psychological warfare now. A man complains that his back hurts because he thinks too much about how much he thinks. I tell him maybe he should relax and think less. He replies, "I can't, my back is too smart to rest." I promised him if he keeps this up, his back will start writing philosophical articles soon. A woman came in complaining that her eyes hurt. She's convinced her vision is getting worse because she can't look at people who are on trend anymore. She says everyone wears fashionable glasses, and her eyes just can't handle it. I suggested she try looking at normal people, but she said that was already too much for her nervous system. A man came in and said his stomach can't digest food because he's too rich for his diet. He explained that his stomach can't handle food that doesn't match his status. I suggested he stop eating chicken and potatoes and try something more worthy, like steaks with golden flaky pastries. A patient claimed her stomach problems are because her intestines got lost in life. I asked if she wanted to eat something light to help her out. She replied, "It doesn't eat anything light, it's lost in complex decisions." I suggested a simple meal, like rice and chicken. She refused, saying, "Too basic for my intestines, they're searching for the meaning of life in truffle pasta." A man came to me complaining about mood swings. He said he has 2 personalities, one is a confident person who always finds solutions, and the other is a helpless loser who can't find his keys or open a jar of pickles. He explained, "When I'm at work, I'm successful, everyone looks up to me, but as soon as I get home I turn into someone who can't find his phone or keys, even though I had them just a minute ago." I asked how he perceives these changes, and he replied, "One personality loves work and communication, and the other is just a guy who gets lost in the closet and can't find his socks." Then he added with a smile, "If I forget my keys, it's not my fault, it's the third personality that hides them. I'm in conflict with it, it does everything to make my life inconvenient." I suggested he keep a journal to understand when his personalities start to emerge. He said he'd try, but he already knew the journal would disappear just like his keys.